Hi, thanks for joining us at Tea Time Discussions with Dr. Montour and Anastasia Nero. We're going to be discussing COVID-19 vaccines. My name is Terry Ramirez. I'm the Indigenous Health Strategy Specialist with Hamilton Public Health. Thank you for joining us, Amy and Anastasia, or Dr. Montour and Anastasia. Dr. Montour, can you introduce yourself?
Yes, my name is Amy Montour. I'm Haudenosaunee from the Six Nations of the Grand River Territory, and my training is in family medicine.
Anastasia, can you introduce yourself?
Yes, thank you, Terry. My name's Anastasia Nero. I work at Didwada Aboriginal Health Center in the Healthy Living Department. And, thanks for inviting us today because a lot of people in the community, they have a lot of questions about not only corona, but also the vaccines. So it's a good opportunity to connect with Dr. Montour and Public Health to sort of talk about some of the questions that people have.
So I know a lot of people are even still wondering about COVID-19 itself, and COVID-19 is an illness caused by the coronavirus. Symptoms can take up to 14 days to appear, and they can be something from very mild to something very serious. Over 2 million people have passed away from COVID-19. And like I said, the symptoms can vary from person to person.
Yes, the symptoms can include fever, new or worsening cough, shortness of breath, sore throat, runny nose, nasal congestion, difficulty swallowing, change in taste or smell, nausea, vomiting, diarrhea, or abdominal pain.
So if you have any of these symptoms, it's important to get tested. And it's important that you contact your local public health unit to find out about testing in your area. If you are in Hamilton, you can book a test online at www.hamiltoncovidtest.ca, or you can call 905-974-9848 and press number 2.
So if someone thinks that they have COVID-19, what are the best ways that people could, what should they do to avoid spreading it?
If you're concerned that you have COVID-19, you should stay home and self-isolate for at least 10 days after your symptoms have started or while awaiting your test results. After 10 days, you can stop isolating if you no longer have a fever and your symptoms have been improving for at least 24 hours. If you're still unwell at 10 days, though, you should contact telehealth or your healthcare provider.
Thank you. So I guess I wanted to talk about the vaccine. And, there's a lot of fear in the community that, the Indigenous community would be guinea pigs for the vaccine. Do you think that the vaccine is safe for people to take?
Well, I can tell you that Health Canada has approved 2 vaccines currently. One is produced by Pfizer and the other by Moderna. Now, I know that sometimes the scientific information behind vaccinations can be confusing, but as a physician, I've been able to look at the information, and I can tell you that Pfizer is 95% effective and Moderna is 94% effective after the second dose. And for those folks who are worried that perhaps we are being used as guinea pigs for this vaccine, I would like them to know that clinical trials across the world have already enrolled 70,000 people into this vaccine trial. A small percentage of Native Americans and Alaska Natives were also enrolled in this vaccine trial. So across the entire world, 70,000 people have already experienced this vaccination, and the side effects have been documented from that clinical trial.
And what are the actual side effects that people could experience with the vaccine?
About 90% of people actually don't have any side effects, but around 10% will experience side effects. These side effects can include soreness at the point of injection, fatigue, headache, or muscle pain. These side effects are likely to be moderate, so not very severe, and will resolve after a few days.
And are kids going to be vaccinated? I know that I've heard, that the target for the world is to get 70% of the world vaccinated. Are kids going to be included in that target of the world 70%?
At this time, we're not including children in the vaccination. The Pfizer vaccine has been approved for people over the age of 16, and the Moderna vaccine has been approved for people over the age of 18. There are clinical trials happening right now with children above the age of 12, but we do not have the evidence yet. Therefore, we are not vaccinating children at this time.
Thank you, Dr. Montour. I guess I have two other questions, but the one question is, I guess the first question is this. If we do get vaccinated, are we okay then to just sort of resume life the way it was before the pandemic hit? Yeah.
Well, no. Getting the vaccine is a good step. However, we have to continue with our safety precautions. We have to continue to socially isolate, to maintain 6 feet distance between each other, to wash our hands faithfully, and to wear our masks indoors and outdoors when we're going to be around people that are not in our immediate household. To do this, we have to continue with vaccinations and our isolation procedures and safety precautions until we get to around 70% of the population being vaccinated. And then we will have something called herd immunity, which will protect the larger population.
And I guess my other question is that, you know, the vaccine, in previous times, it seemed like it took so long for people to come up with vaccines for other diseases. I think people feel a little bit skeptical because this corona vaccine, you know, sort of came out so quickly. Do you have any comments about that?
Absolutely. It is true that to develop a vaccine usually takes several years, but that's when you are dividing resources in the healthcare world amongst many different things. At this time, and throughout the past year across the world, international researchers, scientists, governments, and healthcare administrators have gotten together, pooled their resources, and everything in our world has been targeted towards finding a vaccine for this COVID-19 virus. So because we've targeted all of our resources that quickly and put them all together, we've been able to come up with a vaccine very quickly.
Okay. And I guess, you know, there's always a risk versus benefit analysis to anything. And I guess I wanted to know, you know, of course, even though the vaccine is effective and it's safe and it seems to be our best shot at sort of beating this pandemic right now, always there's everything that comes with a risk. If there was any kind of risk factors for getting the vaccine, like, you know, what are the risk factors, and did anyone ever die getting it, or, you know?
So as I said, about 90% of folks don't experience any side effects with the vaccine, but 10% will. And there have been media reports and some fear in the community about dying from the vaccine. I can tell you that the World Health Organization has done a deep dive into those cases, looking to see if the cause of death was actually related to the vaccine. And in those cases, it was not. The vaccine did not cause the death of those people.
So what about if someone had coronavirus? You know, is there anybody that A, should not get the vaccine at all? And B, if someone has had a confirmed case of corona, should they get the vaccine?
Yes, if you have had a confirmed case of corona, then yes, you will still need to get the vaccine. At this time, we do not know how long you will have immunity in your own body from having an infection from COVID-19. So it's important for you to still get vaccinated. And your second question was?
My second question was, let me see, it was about, should you get the vaccine if you've had corona? And the first one was,
oh yes.
Yeah, contraindications.
Absolutely. It's important that you know your own health conditions and what you're being treated for. And if you do have chronic health conditions, you should talk to your physician or a nurse practitioner to understand what your risk is. There are certain health conditions that we know may present more of a risk, and these include an autoimmune condition, any condition that leaves you with immunosuppression, If you have allergies, if you are pregnant, planning on becoming pregnant, or breastfeeding, if you're taking blood thinners or have a bleeding disorder, or if you've had a recent fever or COVID-19 symptoms in the immediate time before you're planning to get your vaccinations, you need to talk to your healthcare provider about that. When you are able to have a good discussion with your healthcare provider about your present health conditions and the risks to you, then you will be able to make an informed choice.
Okay, and I guess I have a couple questions for Terry, and I guess that the first question is, if someone wants to get the vaccine, when will the vaccines be available for people to get?
So right now, there is a 3-phased vaccination plan for the Ontario that's been set out by the ministry. In the first phase of Ontario's vaccine rollout, the vaccine will be available for residents, staff, essential caregivers, and other employees in long-term care homes and retirement homes, as these seniors are at high risk of infection and serious illness if they do get COVID-19. The next on the list is healthcare workers, including hospital employees and staff that work or study in hospitals and other healthcare professionals. We want to protect them. We don't want them to get the virus, and we want them to be able to help those people that are sick as well. Also, the next people is adults in First Nations, Métis, and Inuit populations where infection can have disproportionate consequences, including those living in remote or isolated areas where risk of transmission is high. And we know, in a lot of the isolated communities, flying communities up north, that they don't have the same access to health care like we do here, so it can be a very serious situation. So some of the reasons, sorry.
Sorry, I'll let you finish, and I forgot to ask a really important question.
Okay. Some of the reasons that Indigenous people have been prioritized to receive the vaccine are that there are reported cases of COVID-19 in First Nations living on reserve is currently 40% higher than the general Canadian population, and 44% of Indigenous people in Canada have at least one of the underlying health conditions, and underlying health conditions, including things like diabetes, can put individuals at higher risk for more severe outcomes from COVID-19. So also prioritized are adult recipients of chronic home health care. Timelines for when the vaccines will be available will be determined later due to the delays in vaccine supply to Canada. So we're still trying to figure that out. And when the vaccine will come to Indigenous people in Hamilton and Hamilton Public Health Services and other organizations, you'll need to keep watch of the website and keep connected to your local Indigenous organizations. I'll give the websites for some of the places to look for that later. If you want to ask your other question, Anastasia, and I'll come back to the rest there.
Yes, and the important thing that I wanted to ask Dr. Montour is, what is the vaccine? I know that in flu shots, sometimes it's dead virus, but what is actually in the corona vaccine that is going around these days?
So the two vaccines that we have, the Pfizer and the Moderna vaccines, they are called mRNA technology. And basically what it is not actually any part of the COVID-19 virus. It's a blueprint or a copy that has been made. And what it does is when you're given the vaccine, it gives your body the blueprint to understand what COVID-19 looks like. So when COVID-19 enters your body, the blueprint, the mRNA, is able to say, I know what this is COVID-19, and we have to make antibodies to fight this in your body now. It's not a live vaccine. It's not a dead vaccine. It's actually a genetic blueprint giving your body the tools to understand how to fight the virus.
Thank you. So Terry, will the will the vaccine be, do you think that it will be mandatory at some point for people?
So it's not mandatory, but what might happen is the same thing that happens with the flu shot is your place of work might require that you have the the COVID-19 vaccine, same like they require you to have the flu vaccine. Depends on where you work, but in general, no. It might be your employer.
Okay, thank you.
And there is no cost to the vaccine at all as well. There's no cost to have it. And it is up, like I said, it mainly is up to you. It's the only other people that might have something to say is your place of work. And
Okay.
everyone who wants a vaccine should hopefully get it by the end of 2021. And that's what it's expected.
Yeah. Well, I think that we hit on a lot of the key components of questions that I had. I mean, I do know that, 2.2 million people have died from coronavirus since the start of the pandemic. And, 500,000 of those is our very close neighbors, the United States. And, I guess, is there any other sort of resources that people could access if they have follow-up questions, or if they want to just know more about getting tested, ways to prevent the spread of corona, or how to access the vaccine? Where could people connect?
So one good place to look is your Public Health Services website. So in Hamilton, the Hamilton Public Health Services website is www.hamilton.ca/COVID vaccines, all one word. There is a website there where you can contact your local public health units if you like, where you can go to find out who your local public health unit is and have their contact information. And also the Government of Ontario, the www.ontario.ca/coronavirus. Public Health Ontario, www.publichealthontario.ca, and Health Canada, www.canada.ca coronavirus. There also is, for Hamilton, there is an email address for vaccine questions. It's phscovidvaccine@hamilton.ca.
Thank you.
Does anybody else have any other questions?
I don't, but I would like to thank you both for your time and for sharing your knowledge with our participants and any community members that just had other questions. And thank you so much. And, I look forward to the day where we can meet in person, and hopefully we get to that 70% of the world vaccinated quickly. So but thank you for the information. It was, it was really informative, and many nyawas.
Nyawa, Miigwech.
Yeah. Thank you, everybody. I appreciate you coming out today.